To start us off, newly appointed Cabinet Secretary for Health Aden Duale has vowed to dismantle cartels at the Ministry of Health, more so those sabotaging the implementation of a Social Health Authority SHA.
Duale disclosed that he has the full backing of the head of state and vowed to deal firmly with any individual trying to sabotage SHA.
This as the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, called on the new Health Cabinet Secretary to avoid politics when addressing healthcare workers' issues.
Speaking at Adams Arcade Mosque during Eid al-Fitr, the newly appointed Cabinet Secretary for Health, Aden Duale, believes the problems bedeviling the full implementation of the Social Health Authority was due to cartels in Afya House.
So those who have personal interests, I think they better come to their senses, and before Tuesday, they make a decision, either to work for the national interest of the country or to work for personal interests. If you're working for personal interests, then you have no space in Afya House.
Subsequently, the CS disclosed that he has the full backing of the head of state and vowed to deal firmly with any individual trying to sabotage SHA.
Cartels sabotaged it with the commitment of the Kenya Kwanza administration, with the commitment of the president, with my own commitment. I want to assure the people of Kenya, universal health care is for ordinary citizens. It's not for the elite, and it will work.
Sentiments echoed by Supreme Council of Kenya Muslim National Chairman Hassan Ole Nado, who urged Duale to crack the whip on the said cartels believed to be behind the dismissal performance of SHA.
We have actually realized that hospitals are minimizing in terms of the costs of SHA. So if somebody goes to the hospital and then he has the SHA card, what the hospital is doing, they reduce the amount of money that's going to be consumed through the SHA, and so that they get more cash. Why? Because of the fear. The hospitals have been fearing that SHA is not going to pay.
Kenya Medical Practitioners, Pharmacists and Dentists Union Secretary has in the meantime warned the CS Duale against solving health workers' issues through politics.
And I'm ready to work with all the stakeholders to make sure that our citizens get a universal healthcare system that works.
Hefty medical insurance. So it is not working, and as a new minister, make it work. Don't politicize it, because everybody has been politicizing this.
KMPDU General Secretary Dr. Davji Atela called on Duale to look into the welfare of health workers by ensuring the implementation of the collective bargaining agreements in place.
And therefore, no amount of politics can resolve the issues that are pending. And number one of them is the issue of interns. She must come out understanding their role, and if she doesn't understand, she should go and learn.
So I want to commit myself that all the challenges from the doctors' care, access and quality health care of our citizens, that will be my key priority